Okay, this is Mom, Dahlia. First thing we do is we bring her into the bedroom. We have to get Luna to latch on to her as the first step. So we lay Mom down. She's usually very cooperative for us. She's a very good mom. Zoom in. And so what we do is we take Luna firmly. She's very, very hyper, so we have to guide her to Mom's teat. Bring it over here so you can see it better. And we get her to latch on, and we wait a couple seconds to let her get a good suction. And then we take a feeding tube. Elise, if you can bring the feeding tube and the syringe over so everybody can see it. We just use a 10 millimeter syringe, or milliliter syringe, and a feeding tube that you can get from your vet's office. And they size it and cut it just for you. So once she's latched on, we take the feeding tube and we just tuck it into the corner of her mouth. You can go in pretty far because they suck really deep into their mouths. And then what we do is we just slowly push the formula in. And as you can see, once she starts getting the formula, she calms down just a little bit. It looks like I'm holding her very tightly, but I'm not. I'm holding her somewhat firmly onto Mom so that her hyperness doesn't force her to lose her suction. And if you can come down and you can see her nose a little bit, you can see that she has a little chunk of fat or flesh underneath her nose where the cleft is. And that's the piece of flesh that prevented her in the beginning from even getting the teat into her mouth. So we had to help her actually latch on the first week. We had to actually squeeze the nipple and put it into her mouth. Now the formula that we use is just a basic puppy formula that you can get from your vet's office, or you can get it from Tractor Supply. They sell it at Walmart. There's several different kinds. I really don't think there's any one better than the other. The only thing I recommend is in the first week, there are formulas that have colostrum in them. If you cannot get the puppy to take any of Mom's milk, use the formula that has the colostrum in it, at least for the first week. After that, you can switch to the cheaper formulas. And then we just let her eat, and it's based on her size, so she eats 25% of her body weight on average. So right now she's consuming about 70 milliliters a day, and we just try to break that up throughout the day. We give her about 6 to 7 feedings depending on how much she eats per feeding. Some days she eats a little bit more, some days she eats a little bit less, but it does equal out to her 70. And she eats really good, and we just let her eat, and then she will pull away when she needs a little break. And then we give her a break, we let Mom clean her up a little bit, let Mom help her go potty, and then we offer the teat back to her again. If she's still hungry, then we feed her more. We do not force feed her. The last thing you want to do is feed your puppy more than what they will take, because that can cause them to get sick. It can cause them to throw up a little bit. And when that happens, that's when it can go into her lungs and she can get pneumonia. And pneumonia will surely kill your newborn puppy. And the reason we had to do it this way is we've tube-fed puppies in the past, where we've wrapped them in a washcloth, stuck them in a teacup, and held them firmly and shoved the tube down their throat into their bellies and just pushed in the amount that they needed to eat. Because Luna is so hyper, we did not want a chance doing that. We could have caused damage to her stomach, to her throat. It could have accidentally gone into her lungs. So even when wrapping her in a towel, we just didn't want to risk it. This does take 2 people, which is a little unfortunate because when I go to work, I have to hire a babysitter to come and help. But it seems to be the most effective way. If you look at the syringe, she has already eaten over half of her meal in just a matter of minutes.
Ooh, big fat dirt. Stop.
And here we are feeding our hungry baby. Well, thank you for watching, and any questions, definitely leave them below and I will do my best to answer them. You guys have a great day, and hi Luna.